Welcome to another episode of BHP Book Club. I am your host, Kelly Morgan. Today I'm speaking with inventor Ron Richard. He has written a book called Someday is Today. Get your ideas out of your coffee cup and on the market. And his book is really a blueprint for how inventors can take their idea, bring it into realization, and then get it to market. If you are an inventor, you definitely want to listen up. I'm excited that he's chosen to be with us today. Let's just get right to it. Welcome to the podcast, our newest book club member, author and inventor, Ron Richard. Ron, thank you so much for being the newest member to the book club and coming on the podcast to share your writing journey. Welcome.
Well, yeah, thank you so much for the invite too, and I really appreciate it.
You are very welcome. So we're here to talk about your book, Someday is Today. Get the ideas out of your coffee cup and on the market. But before we talk about the book, let's talk about how this book even came to be. So, I mean, what made you decide to write this book? Like, what's your writing journey like?
Well, I've written articles before for magazines and for medical journals, but I wrote this book based on a lecture I gave at Stanford University about 3-4 years ago to doctors who are interested in getting their inventions onto the market. They've got great ideas, but they don't know how to get from concept to commercialization. So after I did my talk, I was approached by many doctors, and actually that's where I got the subtitle to the book. One of the doctors came up to me and said, I have all these great ideas in my coffee cup, but I can't seem to get them out. Can you help me? And so the book was basically written during actually COVID. So I had all this time, like a lot of people, working at home. And I still own and operate a medical business and a manufacturing company, but I'm also a touring musician. So a lot of that stuff got kind of put on hold. And so it gave me time to write the book. I started working on it last year in March and finished it and published it in January of this year.
Did you self-publish?
Well, kind of. I kind of cheated a little bit. I don't know how to publish a book, so I did get some help from a friend of mine who's published 7 books, and his agent actually helped me, so I can't take credit for the publishing of it.
No worries. So what is the book about? What do you mean Someday is Today? Because that means a lot of different things for a lot of different people.
Yeah, when I talk to doctors or clinicians, many of them said, I've never gone to school to be a business person or to be an inventor. I went to school to be a clinician or a doctor. So they don't know the first thing a lot of times about navigating through the business part of getting an invention on the market. So the book was designed to be a simple blueprint, like I say, to take on and kind of from a real world perspective, give the clinician an idea of how to get funding, how to go through the FDA, how to get a patent applied for, how to develop a concept and get it to a point where it can be a prototype, work with engineers, work with marketing people, salespeople, and even, to the point of where if they don't want to actually formalize a company, it would instruct them how to do licensing, so they didn't have to actually manufacture anything. They could just get a royalty or license the product.
So is the book mostly geared toward clinicians who are looking to take a medical device and bring it to market? Or can any inventor take the blueprint and take their product and bring it to market?
Yeah, that's interesting because I've had other people that are not in the medical field read the book, and I'd say about 70% of it is applicable to just about any entrepreneur or business venture.
So as we're talking about the book, what are some of the things that you can share with me that would how you even start to get your product. Like when you say work with engineers, well, how do you do that? And does that cost money? Do you have to hire the engineers? How do you do all of that?
Yeah, it's a bit overwhelming for someone who's never done it before. And again, the book is a nice, simple blueprint with real life experience examples in there. And so your question about, well, how do I find an engineer and how do I get the basic concept of this even developed so that somebody can understand from a drawing on a piece of paper, what is it that I'm trying to invent? So yeah, that in the, the really cool thing about these types of projects now today is we've got the miracle of 3D printers. So you can take a drawing and have an engineer kind of draft that into something that can run through a 3D printer and make it within, depending on how complex it is, but within a couple hours, you could actually be holding something and the doctor could say, that's pretty close to what I, had in my mind. That's the concept. And then you can fine tune it from there. Now, in terms of finding engineers, there's actually a lot of resources that are free in my book that if you read through there, it will give you insights on where to find help for things that it's basically almost free. And but engineers, depending on if you want a mechanical engineer, electrical engineer, you just go on the internet. You can type in mechanical engineering consultant and type in the city, and it will bring up a list of people that have already put their resumes or they put a website out there that you can contact.
So, I always hear about people that have inventions. One of the things that they say is to get a patent. And is that a complex process? And is an expensive process?
It's gotten a little more complicated over the last probably 5 years than what it was in the past. You have to be more specific about what you're patenting. You can't have a real broad patent. The patent office wants to be more narrow focused on what you're actually trying to patent. I'll just kind of run through the steps. You do a patent pending application first, and that kind of drafts out the general idea. That usually costs between $2,500 and $5,000. After that, when you go to full patent status, if it goes through the patent pending review with the USPTO, then you'll be spending additional money to file the actual final patent, and that can cost another $2,000 or $3,000. So all in all, you'll probably be into it for around $10,000. So yeah, it's not inexpensive to get a patent, and I have 17 patents, so it's cost me quite a bit of money over the years.
And they never expire, right?
Patents expire in 17 years.
So you can hold the patent for 17 years to a product. Can somebody come in behind you in year 18 and take that patent from you?
They could, and that has happened. In fact, when patents expire, they become what's pretty much known as public domain. So someone could copy your product exactly and not have to pay you any royalties or licensing fees or anything. They can essentially just knock it off.
I didn't know that they expired. I really thought that they lasted forever.
Yeah, no. Like copyrights, patents, trademarks, you have to reapply. Like I think trademarks, you have to reapply with those even more frequent. It's like 7 years or something like that. Copyrights, I believe, are the same. So let's say you wrote a song, and I'm a musician, so I've copyrighted a number of songs. I have to renew my copyrights on those, every so many years to keep them up.
Wow. So on average, how long does it take to get a patent?
Right now, with the way the patent office is backlogged on things because of COVID and whatnot, it could take 2 to 3 years for a basic patent. For drugs, new kinds of drugs, unless they're an emergency use, kind of an authorization, like we've recently had with Pfizer and Moderna, it could take anywhere, around 5 years. And it's highly dependent on how many clinical trials you have to run and how many patients have to be in the trial to prove to the FDA that it's safe and it's efficacious. But on the patent side, it's more or less going back and forth with patent office answering questions that they have about your patent, and how fast you can actually respond to them and what information they're asking for.
So if someone is looking to invent a product, what advice can you give them as the first thing? Let's say I've got this idea. I know I can see it in my head. I can draw a picture of it. That's kind of all I've got. What do I do?
Yeah, the first thing I encourage people to do is, it's a pretty simple, free thing to do. Go on the internet and look up, is there anything like it already? It's so funny, when people talk to me, it's like, hey, I've got this great idea. And I said, have you looked it up on the internet yet? Oh, no, I didn't think about that. But, they haven't seen it in their little micro world of their medical practice or whatever. It's like, well, I've never seen anything like this. So I said, well, you might want to go on the internet and just check it out. There might be somebody that already has a product like what you're trying to do. Save yourself a lot of time and aggravation. About 50% of the time, people come back to me and say, you know what, there is something almost like it, or there's some company that's already made something just like it. And then if they don't find it, what I do, second step, is they go to the USPTO, which is that's the patent website. And it has trademarks and patents on there. And you do what's called a Boolean search. It's BORLEAN. And it's a real quick search, and you type in key words about what you're trying to patent, and it will bring up all the things that either are trademarked or patented that have something in common with what you're trying to search for. And that's free.
And then what do I do? So it's not there. So
it's not
my
there.
product's not there.
Then you go, hot dog, I'm going to go ahead and I'm going to start working on writing up, what it is. So I tell people, write a paragraph or 2 paragraphs about the problem and the solution. That's how I approach designing and developing medical equipment. If I see a problem with a large population of patients, like if they have sleep apnea or if they have diabetes or asthma or something like that, that's a lot of people that have those kinds of diseases, right? So if I'm trying to design some specific piece of equipment that's going to help that population of patients, I have to refine and look at and understand, well, there's already maybe certain companies that have an inhaler or a diabetic monitor or something like that. What does my product do beyond what the other solutions on the market already offer? So then you write that down. My solution for a diabetic monitor is that it's wireless, or it works with Bluetooth. It does ongoing glucose monitoring. It alerts the patient through an app. So that's what you would write down, and then you would go visit with a patent attorney and say, look, I've got this concept, and here it is on paper. I wrote it down. There's 2 paragraphs here. Let's read through this, and then I can explain to you as a doctor why I think this is an important solution for a problem.
Yeah, so I guess when you really think about it, all the medical devices out there have been invented by somebody.
Exactly. Someone had, we talked earlier a couple weeks back, and I always use this little phrase. I say, if you see a need, plant the seed. And I tell physicians and clinicians this because they see needs all the time, every day, with patients that come in them. And every patient has a different problem or a different need, even though they may have diabetes, or maybe they've got sleep apnea or asthma. Everybody's unique, and you have to treat them like that. So that's where the problem and the solution comes in, because there's a lot of patients that could be using a product, but it doesn't do everything that it could do. And that's why I'm really encouraging in the book that if you as a clinician see a way to create a better solution, someday is today. Take action, be proactive, plant the seed, and then start to nourish it, fertilize it, because it's going to take some time, just like planting a tree, a seed for a tree. It could take 20 years. I've seen people wrestle with ideas and concepts for years before they actually get to a point of saying, I'm going to take the leap. I'm going to take a step. I know it's going to cost money. It might be expensive, but I've never seen anything like what I'm trying to invent, and it could help millions of people.
So as an inventor and as a clinician who's trying to invent something, how much time, do you think that somebody would have to put into this and still, have their full-time job? Because it sounds like we just talked about the patent process, and you're saying that's 2 or 3 years. So it sounds like the invention part and getting it to market could take literally years.
It could, and you know what, you've really struck upon a pretty important part of patenting things, getting products to market is if you're a clinician or you're busy and you're working 40, 50 hours or more a week. Where am I going to get the time and the money to actually work on my idea? And a lot of times people work on them after work, obviously. Some people that are working in a hospital network, I've just worked with a doctor, for instance, an anesthesiologist, who's inventing a product to use in anesthesia. He talked to the hospital and he struck up an agreement where he's going to split the money that's made on this product, but they're going to allow him to keep developing and working on it at work while he's working. And so there's a lot of different ways you can approach this, because obviously hospitals want to make additional revenue, but then it gives the doctor time to actually use it in almost a virtual or real practice kind of application. And that way they don't have to work 90 hours a week or 80 hours a week, 50 or 60 at work, and then another whatever amount of hours they have to work on their invention. But a lot of this stuff in my book you can do in parallel, and you can kind of take your time and pace yourself so you don't go crazy trying to get your invention to market in 1 or 2 years. But yeah, you might as well, I always use this formula. It takes, at least in my experience, and I've launched over 50 products with sales of over $1 billion. And I've had some projects that go super smooth and I've gotten them out on the market in 2 years. And I've had others that just ran into all kinds of problems with hardware and software and took 5 years. So my formula is things can take 4 times longer and cost twice as much, or they can take 2 times longer and cost 4 times more. So it's a 2-4-4-2 kind of a rule. And I've been pretty accurate in those 2 approaches to the formula. Simpler projects usually cost more than what you think. So I always encourage people, make sure you have enough capital in the bank to kind of at least get you through the prototyping phase and get working models of the product, because that's what's going to attract investors.
Right. So at what point are you ready for people to actually start trying out your product? If you've got this new diabetic monitor, how do you find people, or how do you actually get somebody to try it out? How does that work?
Yeah, there's a couple different ways. You can actually approach a hospital and you can talk with their recruiters and basically say, here's what I'm working on. I'm inventing this product. We're in the process of getting our FDA 510K, but we need to enroll patients in a clinical trial. So you'll have typically a project coordinator, a primary investigator. The hospital then can put out a kind of like a bulletin or an email to, let's say, the doctors that deal primarily with diabetics, and say there's a clinical trial that's going to be conducted and we're looking to recruit patients. And then you give them a website or an email address. The patients, it's voluntary. So
right.
Patients see this posted in the doctor's office. Oh, I'd be interested in being in a clinical trial. And typically patients get paid for that too. So they contact them, they go through a list of questions in terms about their background, their health, and all this kind of stuff. And that's one way that you go about enrolling patients, because a lot of these trials, you're going to need a minimum of at least 30 to 100 patients.
And then you're going to have to track their usage. Is there a length of time that they have to use your product when you're doing a clinical trial?
Yeah, typically the length of time is, it gives the clinician and the observers and the people that are involved with the trial enough experience with it to say it's working the way we want it to work and it's improving outcomes. Or I've seen trials where they're cut short because there's adverse reactions to the product, or there's software or hardware issues. So they shut the trial down, basically go back, refine the product, and then start the trial over again at a future date.
Wow, it sounds like being an inventor, especially a medical product, can take a little bit of time, and a little bit of money, and it sounds like a whole lot of patience.
Yeah, you don't want to get into this and be a type A personality where you want things to happen like tomorrow. I mean, you've got to push, the envelope a little bit, but you do have to be a patient. And I think you have to have, I always use this one phrase, don't forget why you started. And I always tell people, write it on a piece of paper or put it up in front of your desk, and always look at, when you have terrible days with your project, look at that and go, don't forget why you started.
So, Ron, you've written this book to help others get their products to market. Do you offer any type of coaching, or do you offer resources where people can go for coaching or other information if they're really looking for help? Even though the book is there, they might need additional help or resources?
Yeah, sure. The next step would be to contact me on my website, inventing.startstoday.com. You can send me an email or whatever, and I'll, I do 15-minute free consulting time with people just to kind of see what the project consists of. And then from there, if I can't help the person, I know enough people in the industry to where I can, kind of coach them to go in a certain direction with the project.
And is that for all inventors or just for those who are doing medical devices?
Just devices. I don't do anything with pharmaceuticals.
Gotcha. Ron, thank you so much for being on the podcast and sharing the book and all your knowledge about inventing. I'm still blown away by patents. I really thought they lasted forever. So I learned something today.
You're welcome. Thank you. And it's so nice to see you again.
You too. Take care.
Take care. Bye-bye.
Thank you for listening to another episode of BHP Book Club. I just wrapped up with author and inventor Ron Richard on his book, Someday is Today. Get your ideas out of the coffee cup and on the market. I'm so glad that he decided to share his writing journey and his book with us. If you are an author and you would like to be a member of the book club and promote your book, all you have to do is go to my website, brightheadedpublishing.com, go to the contact section, drop me a line, we'll connect, and you could be the next author here with me promoting your book and being the newest member to the book club. I really hope you decide to join. Next week, another author. I thank you so much for listening. I couldn't do it without you. I am incredibly grateful. Thank you all. But until next week, keep writing.